afternoon and welcome to the Human Services Technical Committee meeting. Let's call the meeting to order. Members should be aware that this meeting is being recorded and live streamed on YouTube as a way for members of the public to participate. Please keep that in mind as you comment. I will ask that you keep your microphones on mute when you're not speaking. You can use the chat function through Zoom if you need to make a comment about technical or logistical issues. Please know that the chat will also be recorded and part of the public meeting record. For the purpose of the meeting minutes, I ask that you state your name before any comments so that we can have your comments on record. And finally, for action items, we will be taking a roll call vote. I'll call out the committee names and then ask you how you're voting. I'll try to keep track of just who's here. So if I miss someone because they joined after, because my notes got messed up, please let me know. With that, let's move on to introductions. I'll call each member's name and ask you to introduce yourself and your organization so we're not speaking over one another. Starting with my vice chair, Jacqueline Edwards.
Hi, everyone. It's Jacqueline Edwards, Maricopa County Human Services Department.
And Melanie Dykstra.
I am Melanie Dykstra, Town of Gilbert, Community Resources.
Thank you. It looks like Naomi is not here, nor Autumn, and Laura hasn't joined yet.
Hi, I'm sorry to interrupt. This is Nicky Stevens from the city of Tempe. I'm here on behalf of Naomi Farrell.
Oh, awesome. Thank you, Nikki. Susan Hallett.
Good morning, everyone. It's Susan Hallett with the City of Phoenix Human Services Department.
Thank you. Mary Lynn.
Mary Lynn Tasnick, Area Agency on Aging.
Thank you. Chris.
Good morning, Chris Lopez, City of Avondale Neighborhood and Family Services Department.
And Jason.
Good morning, Jason Matthews with the Valley Sun United Way.
And I don't think Debbie's here from Peoria or Leah from Chandler. And then Cindy.
Good morning, everyone. Cindy Saverino from DES, Division of Aging and Adult Services.
Thank you. And then Brande.
Hi, good morning, everybody. Nice to see you. Brande Mead, Human Services Director at MAG.
And Tina.
Morning, everybody. It's Tina Lopez. I'm from MAG too. Good morning.
Morning. And then does Jeremy want to introduce himself?
Yes, I'm Jeremy from MAG as well with the IT department.
Thank you. We'll move on to the call to the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time of this meeting. Brande, has staff received any comments from the public?
Thank you, Madam Chair. No, we have not received any comments from the public.
And then we'll move on to a request for a motion to approve the meeting minutes. Is there a motion?
I'll make a motion to approve.
And this is Jason, I'll second.
Thank you. That was Melanie and Jason. All in favor? I'll call your name. Melanie?
Yes.
Nikki?
Sorry, unmuting, yes.
Susan?
Yes.
Mary Lynn?
Yes.
Chris?
Yes.
Jason?
Yes, sorry, slow to mute. Sorry.
All
Yep.
right. Cindy?
Yes.
All right. And that leaves 0 opposed. Let's see. Next up, moving on to item 4, the SSBG funding allocations recommendations. At our last meeting, we decided to proceed with sending out a survey to our SSBG funded partners to use their feedback to inform our recommendations. At this time, I'd like to ask Brande Mead to review the survey results.
Thank you, Madam Chair, members of the committee. So I am going to share my screen now and cross my fingers that I can manage the technology. Hold on. Okay, so let me minimize. All right, so can everyone hear me? Okay, so I can't see anyone anymore, so I'm assuming you can hear me. So
We can hear you.
Okay, thank you. So I'm going to walk through the survey results that we received. And before I jump into those, wanted to thank DES for providing us with information for the grantees. We were able to get a list of email addresses, and then Tina also helped with tracking some of those down as well. So we did send out a survey at the beginning of December, and in fact, we sent it out 3 separate times, asking for respondents to please respond, that this was helping to inform this committee's funding allocation recommendations. So we did send the survey out 3 times. We did only receive 7 responses to the survey, but that's feedback from 7 agencies that we have not heard from in terms of representing their use of SSBG funding. So even though it's a small percentage of responses, I do think the responses are important and will help to still inform the recommendations that this committee makes. So I will walk through the responses that were received, and this is the same information that was sent out as a PDF to all of you. Oh yes.
Sorry, this is Jacqueline. And I didn't see it in the materials. I'm sorry if I missed it or misheard. How many agencies was it sent out to? So we received 7 responses out of how many?
That's a great question. I'm going to look to Tina. Tina, do you recall the total number of agencies? I know there were over, I would say over 20 agencies that received the survey. Tina, please feel free to jump in if you know the exact number. We can come back to that too.
Yeah, I don't have the exact number, but I can look it up real quick here.
Okay, thank you. And then when we get through the slides, Tina, I'll come back to you for that. And then thank you for that question, Jacqueline. If there are other questions that come up during the presentation, please stop me. Again,
Brande, this is Mary Lynn.
Sure.
Can you make it a full screen?
I can, yes.
And make it.
Is that easier?
Oh,
for
that's
everybody?
much better. Thank you.
Let me move this over too. Okay. So again, 7 total responses. Why can it? So the first question was, did your agency receive SSBG funding? This was for the target group, adults, families, and children. And out of the 7, 1 responded representing adults, families, and children. And then we asked, what's the greatest financial need and where would SSBG funding have the greatest impact, and to rank the financial need in the services that are provided. So, and actually sorry, I'm going to have to go back to this because I have notes that I wanted to reference. So case management for basic needs for adults, families, and children was ranked as number 1. Emergency shelter for domestic violence victims was ranked as number 2. And then number 3, crisis shelter services targeting children and runaway children, followed by supportive intervention guidance counseling. And I can go through the rest if you like. But I think maybe the top 3 or 4, again, those are basic case management needs, emergency shelter targeting DV, and crisis shelter services targeting children and runaway children were the top 3. The next area was SSBG funding for elderly population. And so of the 7 responses, we received 1 yes for SSBG funding for that population. And the ranking came in as far as the greatest impact. 1 was home care, 2 is adult daycare, and 3 home delivered meals, followed by 4 housing support services. The next area we asked about SSBG funding for persons with developmental disabilities. And again, we had 1 agency respond that receives funding in that area. And that agency noted the greatest financial need and impact for SSBG funding being, again, this is for developmental disabilities, employment-related services and special employment services as ranked 1, 2, employment-related services for in-family home needs, and then 3, respite caregivers for persons with developmental disabilities, and 4, habilitation services. And then that was followed by attendant care and personal care. Let's go to the next. So we asked, did your agency receive funding for persons with disabilities? We had 2 agencies respond yes, that they receive funding for persons with disabilities, and the ranking came in for greatest impact. Number 1, adult daycare / adult day health care. Number 2 was home care targeting persons with disabilities, and that tied with adaptive aids and devices and supported employment, followed by home delivered meals, and that tied with rehabilitation services and congregate meals as being the greatest needs for persons with disabilities. And we also asked, is the current SSBG funding received by your agency targeted to the greatest current need within your budget? And we had 4 total responses to this question out of the 7 that responded. 2 said yes and 2 said no, that the funding received is targeted to the greatest need.
Brande, are you able to tell who said no of the respondents in terms of which categories they said that they received funding for?
Yeah, I could look that up. I don't have that at my fingertips right now, but that is something that I could pull up in the Excel spreadsheet and go through the individual responses.
Okay, great. I think that's important, since what we're trying to do here is ensure that this funding is targeted where it's most needed.
Okay, thank you for that question. We also asked, has your agency received any special relief funding for service areas above, CARES funding, COVID relief funding, et cetera? 6 responded to this question. All 6 said yes, they have received special relief funding. Have you expended all of those special relief funds? Of the 6 who said yes, 2 have expended all of the funds and 4 are still spending down special relief funds.
It might be helpful to know who those 4 are too in terms of category.
Okay.
Well, if I can.
Mary Lynn, I see that
we received for COVID. This is Mary Lynn with Area Agency.
Okay, you cut out.
Received for COVID actually was given to us to run through September of 2021. So I probably one of the people that said no, we didn't, because it wasn't. I know City of Phoenix and some places got money through December of 2020. But others, it's through June of 2021, and then our federal dollars, COVID CARES Act, COVID money, is through September of 2021.
Right, so those dollars are still expected to be, continuing to be spent down.
Mm-hmm.
Right. I don't think it needs to necessarily be punitive if the answer is no. I just think it provides context that there's pipeline.
Mm-hmm. Right. For a limited amount of time, there is still, you know, additional infusion of COVID relief funds for a specified amount of time. So it is important to note that at some point that funding will halt. So we also asked some open-ended questions, and I'm just going to read through these. There weren't a lot of responses, but I thought they were important. So we asked about the impact the pandemic has had on the budget. So one response was, we have site-based programs that have closed since March, currently projecting a $500,000 loss. Have expected approximately $250,000 for special PPE for the community. Our site-based programs as we slowly begin to reopen them safely. So there certainly is an impact. Reflecting back on services, where does your agency forecast the greatest increase or sustained demand? So we heard all are important, those families we see daily, adults, families, and children will have the greatest demand in terms of need, according to one respondent. We asked, is the current SSBG funding received by your agency targeted to the greatest current need in your budget? One response was more funding is needed to assist vulnerable populations. We asked around forecasting services for those special relief funds. Another response was we received support from 2 agencies, expending all dollars from one agency and then anticipating to expend dollars from a second agency to assist the most vulnerable families impacted by COVID. Another response around the budget, more people are coming in seeking help, and we have had to increase the manpower to assist families. Budgets have had to increase to meet the needs of the community. So I think that's a common theme. Feedback around to help improve the impact of SSBG funding. One respondent indicated SSBG dollars provided to agencies serving communities must be increased to meet the demand. What does your organization forecast for services needed? Wages and PPE were the response there. Briefly explain the impact the pandemic has had on your budget, reduction in revenues because of suspension of services, higher wages, due to overtime and incentives to keep staff coming to work during the pandemic. Again, around special relief funds, we heard about waiting lists for home care. Another response around the budget. So huge increases in food assistance, including home delivered meals, food boxes, and food bags. And please provide other feedback to help improve the impact of SSBG funding. A respondent said, when CARES Act funds dry up, over 7,500 elderly will be without food, boxes and bags, and cleaning and toiletry supplies. So again, important feedback. We also heard special relief funding for hotel rooms for seniors and medically vulnerable, ongoing pandemic costs. It says additional $6,500 a month in cleaning, PPE costs, safety costs, etc., due to the pandemic. Another response around impact on the budget due to the pandemic, increased costs over $100,000 a month. Not all is being reimbursed. Hazard special pay has been partially reimbursed, and we've used private funding or fundraising as well. And there's an increased need for staffing with CARES money going toward some of those things that were mentioned. So those were the responses to the open-ended questions. So let me pause and see if there are any questions or comments. I'm going to see if I can.
Brande, we did have a couple people join while you were presenting. I think Leah joined. If you want to introduce yourself, Leah, for the minutes.
Actually, this is Karen Bishop with the City of Chandler. Leah will be joining the meeting soon as well.
Oh, okay. I see both of you on there. Thank you, Karen. Okay, any questions? Any further or comments on Brandy's presentation?
Well, I think it was really excellent. I think the survey was really good. And it gave us, I think, a lot of insight on what the needs are in the community. It's too bad more people didn't answer the survey, but we did get quality answers, I think, from the people that did answer.
Well, and it's like a 30% response rate, which is pretty normal for surveys, if not above normal, isn't it?
Yeah, I think 30% is about what we tend to see when we send surveys out.
And we saw a good mix of the types of agencies that were represented.
Right, and we did have responses, at least one response for each of the different target areas. So that is good.
Brande, can I ask you to pull up the comparison of funding for each year?
Yes.
So maybe we can take this information and transition to this next part of our discussion.
Yes, absolutely. So Jacqueline, I believe this is what you are asking for, right? Okay. So this
can we get those answers about who said no, or is that going to take a while?
You know, I can get those. I don't have them quite at my fingertips right now, Christina. I can be looking for that while you're discussing.
Okay, thanks.
In the meantime, we have, so this is a 5-year look back, broken down. I'll just scroll through this so you can see the whole spreadsheet, and then we can come back to where you would like to start the discussion. So as a reminder, adults, family, children, that's our first target group. And so you'll see in fiscal year 2018, there was an increase, and you'll see this in all the different categories. And that was when the committee had made the decision to pull funding out of the DD category, the developmental disabilities category, because other funds were being received for those services. So in fiscal year 2018, those dollars were redistributed to the other target groups. So that's why you'll see in green an increase. Over the past 2 years, you'll see the numbers are exactly the same. So there was no change from fiscal year 2021 going back to fiscal year 2020. For adults, families, children, the total amount allocated for that target group was just over $2 million, $2.2 million. For the area of developmental disabilities, again, in fiscal year 2018, those dollars were reallocated to the other groups. And this was a category where we had the lowest amount of SSBG funds targeted. There were about $237,000 that were going to that target group and then were redistributed. The next category is elderly. And so you'll see, again, the increase in fiscal year 2018. Last year, if you'll recall, there was an additional $41,000 that was provided to one line item, and that was the only change from last year to the year before, was that additional $41,000 going to elderly home care, which provides funding for home health aid, personal care, respite, nursing services, etc. So that was an increase of $41,000 to that one line item. Going down, persons with disabilities, you'll see that there was no change. There has not been a change over the past, since fiscal year 2018. And that total category receives $59,861. So the total dollar amount that we're working with as a committee is 3.6 million. And so our role today is to determine how we want to distribute that funding for fiscal year 2022. And I'm going to pause, let you comment, and I'll look for those questions to the survey that you asked, Christina.
Thanks, Brande. Anybody
do
want
we-
to open up
Yeah.
the comments?
Yeah,
Mary Lynn?
Christina, this is Mary Lynn. Do we have additional funding for the coming year, or is it just level funding?
We've been told to project level funding. We haven't heard an exact funding amount yet, but what I did hear from DES is to plan and go through our process as if we were receiving level funding.
So if I maybe jumpstart the conversation here, when we look at kind of the state of where we're in and all of our communities are in because of COVID, you know, and I think we've had many conversations that we can't, clearly we can't separate COVID or the impacts of it from our decision-making today. So seniors or, you know, elderly are going to be the most physically vulnerable population due to COVID, especially the people who are receiving services out of SSBG. So keeping them, you know, in their homes rather than going into, you know, assisted living or other venues, or even just being, you know, out in the general public where they are more likely to get COVID and get sick and worse. And then, so that's, you know, I see that on the health side. And then on the other side, you know, the families and the adult families' children, those are going to be the group that's greatest economically impacted due to COVID. And, you know, looking at the recently signed omnibus, it continues to well-fund DD and making line items also for those who have disabilities. So I guess, you know, what I would is maybe start with proposing is that we try to focus our funding, or, you know, focus on the elderly category and the adults, family, and children category, because I think we can make the greatest impact with these SSBG funds, with the agencies that are, you know, receive those funds and help those populations.
Thanks, Jacqueline. Is there anyone who has a different thought than that?
This is Jason. I just have more of a question of clarification for Jacqueline. Is that, do you have a dollar amount in mind, or are you proposing like shifting it out entirely, or what was kind of some of your process with that?
So I would say let's continue doing what we've done for DD. Let's not fund DD, and that's really take a hard look at the people with disabilities section, and maybe we can, you know, concentrate in the areas in which we receive the feedback in the survey that may be most needed, and maybe redistribute the funds into elderly and adults, families, children. And then what I would say in adults, family, children, and elderly, you know, at least do what we've done in the past, but maybe it's time to take a look at switching up some of the categories. So adults, family, children, even with the additional funds that have been received, those case management line items are ones that, you know, agencies continue to be more limited in what they can fund, whether it's, you know, oh, you can't spend any more than 10% on that service. And we know for outreach, etc., that how important case management really is to connect with other services. And then for, you know, elderly, maybe, and you know, this is where I, you know, ask Mary Lynn to share some of her insight too, that even though in the survey we saw that, you know, home care and adult daycare had the greatest needs, if we're planning for the future and with the funds being the CARES Act funds that are currently being used for home delivered meals, et cetera, ending in September of this year, would it make sense to push more funds into home delivered meals so that the people who are receiving funds now or meals now can continue receiving them even after that, or maybe at least a portion even after that funding ends?
So this is Mary Lynn. I will answer with my opinion, and I think Cindy Saverino can add to it. Fortunately or unfortunately, Congress, the federal government, has a real strong preference to fund only meals programs. So they put a lot of money into home delivered meals and into what we call congregate meals or meals in a senior center. But what they don't give us nearly enough of are these other supportive services such as home care, adult daycare, and those kinds of services. And so that's the only reason when I answered the survey is when we have a waiting list, the waiting list is always for, you know, the personal care, the homemaking, adult daycare, attendant care, those services. And we are always able to serve anybody that wants or needs a meal, we're able to do it. It is true, though, when COVID CARES Act money does end, we have many people who are getting home delivered meals so they don't have to go to the grocery store. They don't have to, well, senior centers are closed, so they can't go into a senior center to get a meal. And so there will be that challenge. But I still kind of believe that the in-home services and also adult day health care are going to be very critical to keeping people elderly healthy.
And this is Cindy. I agree with what Mary Lynn is saying. I mean, the home delivered meals for a lot of folks right now, it's a lot of it is temporary also because the senior centers are closed. Yes, we will have those individuals that will continue to need home delivered meals, as Mary Lynn stated. But again, the critical area for us is those in-home services, the personal care, et cetera, that, you know, adult day health that, again, help individuals maintain within their home for as long as possible. So.
And this is Melanie with Town of Gilbert. And I know just with some of the other sources of fundings we're able to provide, it's easier for us sometimes to allocate our CDBG CV to Meals on Wheels and things like that. That's an easier thing to, and we have done. So I don't know that I would be as able to use other sources for some of those other services. So to me, like Mary Lynn said, you know, I would agree that maybe some of those other ones would be more appropriate with this level of funding, because there are some other sources and support for the meals types programs, especially in if the centers open back up. That's something that a lot of our other funds can go for.
So follow-up question to all of that great information. So I'm hearing the home care, personal care, that category really being a need and maybe not other funding being there. So do we, in taking a look at those line items, do we push more money into that category from whether maybe it is taking money from home delivered meals or for some of those other line items and push it into there? Any thoughts on that?
And maybe. I guess that would be a question, because I don't know if they're counting on level funding. You know, it's like they've kind of identified what their level funding normally is to keep the program going, and they're using some of these additional resources to get the above and beyond that's being taken care of. I just guess I wouldn't want to reduce obviously the home care piece, or if that is where we had put some extra, is to leave it there. So I know it's tough to move stuff around just because I know most organizations are hoping for at least the level of funding that they've had, but I would think that maybe they would look to have that similar piece, and that they've been requesting or utilizing their additional sources because of the overage that they're having right now. But Mary Lynn might be able to speak better to that.
I mean, one option would be to take, I mean, I don't know, it'd make a big difference, but, take maybe 25,000 from home delivered meals, move it into home care, or, as I forget who was saying, I think Melanie was saying that probably the cities and towns can help with meals programs, or they have other fund sources for that. So I mean, we might be able to do, if we wanted to do some shifting, is 25 and no more than 50,000, because the senior center, see, the home delivered meals all go through the senior centers. So if you reduce the home delivered meals funding, that impacts the senior center budget, because they get funded for congregate meals, and then they get funded for home delivered meals, and then they get almost nothing to run the senior center itself. Most of the funding that we give them is for the 2 meals programs. So I don't know if any of your local cities or towns know if senior centers are struggling, and would they struggle if they were reduced in funding?
Thank you. Those are good points, Mary Lynn. And Madam Chair, I do have those survey responses pulled up. So if you'd like, I could go back to the questions that you asked from the survey responses.
Thanks, that would be helpful.
Okay, so I believe the first question was around, we asked, is the current SSBG funding targeted to the greatest current need? We had 2 saying yes and 2 saying no. And were you asking what agencies responded yes and no? Was that the question?
Not the specific agencies necessarily, but what area of funding were they saying they were getting funded for, or what category of population do they serve?
Okay, so one that said yes, they are targeted to the greatest need is around funding for elderly. There was another yes. Let me see who's. This was for persons with disabilities. So for elderly and persons with disabilities, they said yes. And then the 2 areas that said no. Sorry, I'm having to toggle through a large spreadsheet. Give me just a second. Those were for adults, family, and children, and DD.
And DD doesn't even get any.
Right, but we did receive a response from an agency representing the developmental disability population.
Okay.
So it looks like they are still receiving funding from other sources. And then was there another slide where there was another question?
Which still have CARES Act money or funds available to them?
Okay.
Again, not the specific agency, but the line.
Okay. Let me find that. Okay, so have you expended all of the special relief funds, correct?
Yeah.
So we had two that said yes to that. So are you wondering about the ones that said yes or the ones that said no? It'll be
Yep.
easier for me.
No.
Okay. So it looks like elderly, adults, family, children, and persons with disabilities.
And
So
this is, I think, kind of why I wanted to ask the question is I think it supports what we're trying to do here, because so often funder constraints on how you can spend the money impede your ability to spend the money. And those are the same groups who said the funds are not being targeted the way they need them to be targeted. So I think we're on a, I think that's affirming that we're on a right track in terms of where we're looking at moving funds around.
would you like me to go back and share my screen so we can look at the spreadsheet again?
Yes, please.
Okay.
Yes.
Is there anybody who thinks we're not on the right track? Susan, Chris, you have senior centers, I know for sure, in your cities. Do you have any further information to add to what Mary Lynn shared?
No, so this is Susan. I echo what Mary Lynn has said, and also some of the thoughts that Jacqueline was sharing. You know, one of the dynamics that we're experiencing because our senior centers have been closed is, you know, the reality, and I'm just being fully transparent right now. The reality is that our senior centers are not costing as much as they were when we were in full operation, right? We don't have electricity bills. We don't have, you know, programming supplies. We don't, there are dynamics that allow us to, you know, make some adjustments. So what I like about what, you know, this is that this is driving funds towards individuals in their homes. That's where the need is right now. And so if anybody's asking, you know, from an agency perspective, do I think that we need to, you know, put money into supporting, you know, senior center operations? The reality, at least for the city of Phoenix, this may not be everybody else's circumstances. You know, we're a large, you know, operation with 15 centers. We are looking to repurpose our funds because we don't have, you know, the 4,000 to 5,000 membership coming into centers at this point in time. The only other thought that I was going to mention, just so people have it on their radar, is at least for the city of Phoenix, what we've been spending some of our funds and our effort as of late is knowing that when we do reopen, we're going to have a very different experience in our senior centers. So we are making improvements in our senior centers. We're you know, switching to, you know, touchless water faucets and you know, doors and lighting systems, and we know that our janitorial costs are going to increase because we're going to have you know, more frequent cleanings and all that kind of stuff. But at least for this fiscal year, it doesn't look, at least for the city of Phoenix, it doesn't look like we're going to be reopening our centers. And so I would say that the greater need at this point in time is for individuals in their homes. So I think that the direction these recommendations are taking aligns with what I feel the need is.
And Christina, this is Chris Lopez. I would agree with most of the comments that have been made today so far. We have seen, I would say, over a 15% increase in demand for our home delivered meal services. So, definitely consistent with the comments that have been made. I don't believe we're quite in the same boat as the city of Phoenix in our ability to transition operating funds to other programs. We still have the lights on, and we're still doing congregate meal pickup, curbside pickup in our kitchen. Lights are still on. But I think that would be the only difference for us.
So I think there was a suggestion previously made by Mary Lynn to move $25,000 from line 17, that's the home delivered meals, to home care. Everyone, maybe it's if you don't like that idea, say something. Okay, Chris.
I'm supportive of that idea.
Okay, thanks, Steve.
And Jacqueline, just to clarify, okay, so you're moving 25, or the recommendation at this point is moving 25,000 from line 17, which is home delivered meals, to which line was that, to line 20?
Yes.
Okay, just making sure that I have that correct.
Great. Then unless someone else has something to say about the elderly section, the senior section.
I just had a question. This is Melanie with Gilbert. When I recall, I thought it was last year we had said we had moved additional funds there, but then at one point there was a question whether those had actually been realized within the budget. Do we know for sure that actually, when we did that one increase in the past, did they actually see the additional funding?
I believe,
Yes, I think that it did happen. Cindy Saverino, maybe you can clarify, but it didn't get moved right away, but we eventually tracked it down with the help of DES, and we did get that additional funding.
that is my understanding as well.
Okay,
And
I just want to make sure.
Maybe we can move on to the next section, lines 22 through 28.
Okay.
People with disabilities. So based on our conversations thus far, I see that we could just keep it the same as we have had the last 2 years, or we could move some of these funds into elderly and or adults, family, and children.
Well,
Overall.
This is one of the groups that said the funds were not currently targeted towards the greatest need. Does anybody have any insight into what might be meant by that, or where there might be opportunity to improve how they're targeted? Because I see.
And are we sure it was people with disabilities? It's not the DD that they are responding to, was it?
Oh, you're right. You're right. People with disabilities said it was targeted. So they're saying that they have a good thing going right now.
Okay.
But adults, families, and children are where we see an opportunity. And that was reinforced by the suggestion for increasing in case management, I believe.
Yes. I said both for both categories of case management, number 2 and number 9. So maybe I'll get in trouble here from other folks' thoughts, but with emergency shelter and housing support services, there really is a big influx of funds, and with MAG and the county and the cities and towns and United Way, the whole consortium taking a look at how best to meet the needs of people experiencing homelessness. I also know that there, it's not just federal funds, but there's likely to be other funds pushed into this system locally. I mean, even from the county, it's been highlighted by our new chairman yesterday. So, areas like the case management basic needs, especially, is something that I think we could push a significant amount of more funds into. That this is an area that's severely limited when you're receiving or when you're receiving other funds. SSBG is the one area for case management on basic needs that provides flexibility to agencies.
This is Melanie with Gilbert. I had a question about that. So if that was to be the case that we moved from, and I don't disagree with some of the shelter support, because again, I know some of the funding resources we've had, that is an easier thing for us to fund is, to the shelter pieces, although we do anticipate some of it is going for, the staff with case management. So when we talk about this case management, is this specific organizations that are case managers? Is it guide? I mean, I'm not sure how they utilize this. Does anybody know?
Yes, I know. We receive it here, the CAP. In Maricopa County, all of the agencies who are CAP designated areas receive SSBG. And it is more of a flexible fund source than other funds like the utility, like LIHEAP funding. So this typically, at least here in the county, and how we use it for the cities, towns, and nonprofits that we work with in our community action network, is that SSBG is used to fund personnel.
Okay.
Susan,
well,
I don't know if you can.
Great.
I don't know if you want to share what. Oh, okay. Susan has a thumbs up happening.
Well, and I agree, because I think we're noticing that, like for Gilbert in our CAP office, I mean, we are definitely, it's in order to process all the other things, or it's like we don't really have a case navigator, and we need one because that's just something we're lacking. So I definitely can see that as a benefit. I guess my thought is, if we do that, is whether or not that kind of gets highlighted, is that our intent in doing it is that it does, get used for the people. And obviously, I just didn't know how that gets relayed back as to what that looks like.
I don't think that we have, and Brande, please correct me, but in past years, we can't actually like tell DES to let the agencies know, like, oh, you have to use it for this specific thing. But in each of these categories, when DES pushes out the funding, it is limited what can be done. So it says, okay, yes, you can be used for case management, and then it provides the list of items that the funds can be spent on, and especially right now. Well, what I will also say is that so much of the time the case management is really just on crisis assistance, but SSBG, it may give us an opportunity to take a look about longer term case management to help those adults, families, and children reach sustainability, rather than just case management. Let me process a utility payment or a rental assistance payment. That case, if there's more staffing or more funding in there, then staff may have an opportunity to go back and have additional conversations.
This is Jason. Sorry, don't want to interrupt. So this is Jason, and it's just a point of consideration, is that at least from what we're hearing from United Way's side, and I totally, Jacqueline's right on as far as the other elements and some of the relooks, and with a new federal reality, with this new administration and Congress, there might be some, who knows what's going to happen. That's probably every year. All that being said, I will say that hearing from at least the organizations that we work with and we fund, especially within the emergency shelter space, that there's just been COVID has just brought forth just like parallel increase of costs of just doing business, and especially as a lot of these, and again, this doesn't just, it's not exclusive just to the shelter services. I think this applies across the board, but really in looking at emergency shelter in kind of a public health perspective and keeping everyone safe. Now, granted, there's been extra dollars for that, but in some of the focus groups that we're having as of literally Tuesday, there's groups that, and actually yesterday, I have no idea what day it is, but the idea of just the amount of just staff burnout and just the extra duties and costs that are associated with staff have just been not only through the roof, but also been they're just there's just a general like assessment of, they're just worried that there's a breaking point with staff, and there's a breaking point with some of those flexible dollars that can like allow for just keeping staff happy and keeping them content, to making sure that there's some ability for them to have time off or just to do some other kinds of things. So just a point of consideration that as we're looking at some of these moving of these dollars around, just being mindful that some of these reductions will be like, so we're trying to deliver these vital important services through a global pandemic, and we're keeping the rates of transmission of this deadly disease down to low in comparison to other communities, and you're cutting our funding. So it's just want to just put that out there as a point of consideration. And I know it's a limited funds but just want to put that out there as a point of consideration.
And I'd like to ask, this is Mary Lynn, I'd like to ask Laura about the funding for domestic violence. I know there's a couple of stories there for the counseling and emergency shelters for domestic violence, because I think it's been on the rise significantly since COVID. And I don't know how the funding is keeping up with it. Laura Gildon?
No.
Oh, I thought she was.
No.
I thought she was. Her name's showing up.
Laura's is?
Yeah, she's here.
Oh, yes.
Okay.
She's on there.
All right. Now, with all the stress of just finding the unmute button. So, Mary Lynn, you just want to know kind of, unlike some of the other services where there has been a lot of infusion of federal dollars into the services such as SSBG and not SSBG, CDBG and Emergency Solutions Grant, there hasn't been that kind of funding specific to domestic violence other than through one federal fund source that is relatively small in the state. So I think that need is still there. Obviously, back to what Jason was saying, the continuation of maintaining safety within residential shelters is going to continue, and programs continue to innovate as the pandemic continues to change in terms of what their needs are. So I would say that that's definitely a need. That's not, people are using shelters, and it's going to continue. So I don't see that has any radical change, but certainly there's been no decrease in need.
An increase in need related to domestic violence, is that correct?
Well, yeah, that's what I'm saying. I mean, and the need is not just people calling and saying, help me. A need can be defined as all of the things it takes now to maintain a residential programs in a safe manner. So that need is just a broader statement that goes beyond just individuals.
So I have a question about lines 8 and 9, those programs. Is there any opportunity for overlap where the recipients in those categories could also potentially access funds from case management basic needs in row 2 if they had a demonstrated need?
So, Madam Chair, would you like me to I don't know if you can all read what the service intent is. Would that be helpful for me to review that for those
Yes.
line items?
Sure.
Okay. So for line 8, the service intent is counseling for high risk, says child to prevent the child's lack of self-esteem, poor school performance, illiteracy, functional limitations. The service may also address impacts upon the child resulting from inadequate parenting, inadequate role modeling, poverty, family stresses. Assistance may be provided in a community or school setting. The intent is not to supplant other funding, but to expand this type of service. So that's for line item 8. We currently have 42, just over 42,000 targeted to that. For line item 9, it's to assist pregnant and parenting youth to resolve immediate problems and secure necessary resources to achieve self-sufficiency.
Brande, I know this is a question we all keep asking. I'm not sure who's getting that funding. What it's under AFC, I see that, but I don't know which programs specifically are receiving that. If that's CCS or.
And I don't think we have that noted. Let me look.
It's
No.
not DV. It's not DV. I can tell you that.
No, we don't specifically have that noted. What nonprofits are receiving that? There are some. I don't know if this is the case, but I know there are some homeless youth programs that support pregnant and parenting youth who may be experiencing homelessness. I don't know if that's where this is going, but that could be.
Yes, now that you say that. I don't know that.
So with the conversation, maybe to move us along a little bit, with the conversation, is it the sense that everyone wants to just keep these categories as they are now? Or was there any, any sense that we did want to move something around? Because we can go build on that.
So this is Susan, and I apologize for introducing something possibly new, but I'm wondering with the current categories. When I look at what Maricopa County and Phoenix, and I imagine, on a larger scale, what people are experiencing right now is the housing crisis, eviction, prevention. And when I look at these categories where there's housing support services, it typically refers to individuals experiencing homelessness. There's this whole group of individuals. They're not yet homeless. And part of the challenge that we have is some of the federal funding that we receive actually has certain criteria that you've got to have a 5-day notice and things of that nature. So there's this whole group of people that are on the verge of being homeless, but they don't necessarily have the circumstances that that allow for ESG funding to be applied and so on and so forth. I don't know enough about this taxonomy code to know if there is a category that is possibly missing that we should be considering, knowing that the eviction crisis in Maricopa County is exploding, and it's only going to get worse here in the next 6 months, year. So I'll throw that out there, and just if my timing's off, I'll apologize, but I just worry about that area.
I think that's a really great point, Susan. And I think that's part of my contention of moving more funds into the case management and basic needs, because that's broad can go into, and then there becomes more flexibility in how services are being provided on the front line. The funds here for emergency shelter, those experiencing homelessness. It's really little compared to the influx of money that has happened since the beginning of the year, and that's expected to happen this year. Like, just know we just put another $5 million into it, which is a drop in the bucket compared to what everyone else in the county is doing. So then when I see, a few $100,000, yes, it's a big deal, but where other funding is coming in, we could use this to speak to what Susan was saying and push it into an area where we may not have so much flexibility or eyes on with everybody right now.
I think Jacqueline and Susan, and to your point, I think that based upon that, if there was going to be any movement of funds, and I hate to pick on the large line item, but I mean, looking at that case management number, if there was going to be a movement, I think I would be supportive out of that case management basic needs at line 2. And again, moving any dollars from anywhere has impact, and I recognize that. And so, but at the same time, I think that if there was the point that Susan made and the point that you made, and again, it's just, we know there's a lot of funds that moved in there and we have no idea what the future is going to be, but we can, we've all been in this business long enough to know that it'll probably be a little bit more favorable than it was 4 years ago, for example. So all that being said, we're still looking into an unknown future, but if there was going to be a movement, I think, and I don't know what the dollar amount is, that's the other thing, but if there was going to be a movement, I would probably look at that line too.
So thanks, Jason. Let me just clarify, because I don't think I was clear. My suggestion is actually to move more money into line 2. Because
Thank you.
that would help. Sorry, I didn't mean to confuse folks, and actually move money out of some of the other more targeted lines below it.
And Jacqueline, the one question that I would have about this, and then it kind of goes back to something that Laura asked earlier, and I believe that we requested this last year. I am still a little bit curious as to, it would be so nice if this crosswalk that you've put together, Brande, has the identified agencies. And one step further, are the agencies using the funds for staffing, or are they using the funds for services? Because in fairness, I can imagine somebody looking at the city of Phoenix and saying, well, my goodness, if you're getting 500,000, why are you putting that all into staffing? Aren't you guys kind of responsible for, having your own infrastructure? We want that 500,000 to go to services. So those are two, I guess, tier 2, tier 3 levels that I think I find complicated. They make me feel like I don't have the full picture in order to contribute to this conversation.
Well, and if I could add to that, this is Christina, but these are also federal funds. So do we know that they don't have the same constraints in terms of percentages or whatever that other federal funding programs do?
Yes, I at least SSBG is more flexible. It's like CSBG. You have much more flexibility with this, because it's these funds than
which is why
or ESG.
Go ahead.
No.
Yeah. So I was just going to say, which is why, again, people like to receive SSBG, but again, if you find that an organization is receiving SSBG and they're, I'm gonna be fully transparent. We absolutely use SSBG funds to support staffing, but then the question becomes, okay, so what work are those staff doing, and how do they ultimately contribute to? I'm pointing to the screen. Contribute to these individual categories.
Well, I mean,
are you speaking?
Well, I'm just, Susan,
Oh.
I understand your point. I'm just, how do you provide services without staffing? They're one and the same. I mean, that the majority, like in a unit rate for us for domestic violence shelter services includes all the costs associated with providing that service to the individual, which includes a staff amongst other things. So I don't know that.
Unfortunately, Laura, that's not how the funds, when we're providing services, it's much more limited, that you don't have enough for case management or the supervisor. So then, I mean, we're also talking about the people who are overseeing the work, who are oftentimes just as important to make sure that the job gets done. So there's not enough. There's a ton of limits, and then depending on the services provided, you don't have flexibility. So if you're providing someone with specific, utility or rental assistance, when the auditors come through, you have to show why you chose that allocation to spend them on it, or to charge them to those categories. And when you have funds like SSBG or it's great when if there's general funds or non-federal funds, it just opens up the ability to not just help the people for that immediate crisis, but for a longer term time.
So is there a motion? So do we still have two competing ideas then? Could we have like a spokesperson for each idea, kind of give a 30-second argument for their point of view?
Madam Chair, this is Chris Lopez. I'm not sure we're hearing competing ideas anymore. It seems like we've kind of come to a consensus, and it sounds to me like the funding as presented is what people are looking at and likely to be the recommendation.
Oh, not moving anything into case management basic needs.
Madam Chair, if there was like a recommendation as far as like, moving from line blank to line 2, I think that's probably, I'm willing to definitely entertain that. And so, but because I think that there's actually some strong cases to be made for that. I just haven't heard a dollar amount. So like that's where I'm kind of pausing on things. Yeah. So I don't know if there's someone that has a dollar amount in mind.
I'll throw something out there. You guys can all say this is a terrible idea. I'm totally fine with that. My feelings won't be hurt. But I'm going to suggest to move $200,000 out of line 5 and put it into basic needs. So out of emergency shelter and put it into basic needs.
You're going to cut homeless services then?
Yes. Yep.
Yeah.
And I would, honestly, I would remove all of it. I just know the commitment of non-federal funds and federal funds into homelessness into our county. And there's all eyes on it.
Yep. I think we are seeing that at the municipal level too.
Yeah, I mean, municipalities are putting a significant amount of funds into this and focusing on this as well. So it's because of the work of all the cities and towns. So I mean, I would say 200,000, and if it was the world created by Jacqueline, I would push all of the money out of that and into basic needs. Keep domestic violence where it's at, but push as much money as possible outside of domestic violence into basic needs.
This is Jacqueline. I do have a point of clarification. So what is the defense for line, say, 4, 6, 7, 8, and 9? The hold harmless.
Yeah. Oh, so for 7, for what we had heard for 7 and for 3, because it's associated with domestic violence, to keep that, hold them harmless. But I don't, like I said, I would pull money actually out of the rest of those categories and put it into outside of 3 and 7 if we were going to be really drastic. But
okay, so essentially, like, you would feel the same thing for like line 4, you'd feel the same thing for line 8, and the same thing for line 9.
Correct.
Okay.
Because of the specialized nature of the shelter and support? Question mark.
Yeah. Yes.
You know, one of the problems, I think we talk about this every year, this is Mary Lynn, is that we don't know how these funds are used. We don't know what they provide in terms of how many people are they seeing, and what kinds of services are they actually doing, you know, where, when. And so maybe this is something for next year that we want to look at, is trying to find out who is receiving the funds and how many people are being served with those funds.
Yeah, Mary Lynn, this is Susan. Again, I'm in full agreement with that. I think, like I said, that tends to be my challenge with this exercise, is that I feel like we're just, moving boxes on a page instead of really having some sort of strategic, means for doing that. My overall reaction and in support of what Jacqueline is suggesting is that I feel what our communities are experiencing right now is a disintegration of the safety net and the basic needs support system. And
Yeah.
while I'm incredibly committed to addressing the issues of homelessness, I feel like we've got to work farther upstream. I think we've got to really focus on those people that are on the cliff instead of the ones that have fallen off the cliff. And that's kind of my explanation for why I think moving services around is important. That said, unless or until we know, if we shift 200,000 into line 2, we're no better off unless we know what line 2 is actually, who's getting line 2 money and what are they using it for? Because if they get line 2, if let's say, for example, if it's you, mom, that gets part of line 2, we know that they're using their funds to address homelessness instead of addressing the working poor with eviction notices. You know what I'm saying? I don't know if that's how this works, but I do think that there's, I would just rather work farther upstream.
And that's supportive to the regional and encouragement to do homeless diversion, right? Also, by working upstream, as you say.
Yeah, I just to chime in, I do agree with Susan's comment, and I mean, again, these are not easy conversations, but I know that there is, it does. I forgot how arbitrary these funding decisions can be. It does seem like you are literally, throwing darts at a dartboard without knowing where things are going. I just remembered what I love about the technical committee. So I mean that in a lot of affection and love. And so at that being said, I think there were some of my concern, and Jacqueline, I'm not like, your point is absolutely well made, and I think that there's putting so much emphasis into basic needs and domestic violence, and for the points that were made by others on domestic violence, I just have concerns of like how it's kind of like this like wonderful little like headline test of like we funded case management, but we also took away the ability to keep the doors open on the building where the case management's going to be. Now granted, is that true? I don't know, like probably not, but it's one of those kind of like weird kind of things. And so I think because without that lack of detail that's there, that unfortunately puts me into a default of being more conservative in some of these kind of movements. Maybe if there was, taking away from all of them to add up to 200,000 and then adding it over to basic needs, maybe that's an idea. But I just feel personally, and this is just me speaking, I'm just, like, I'm literally just moving things around, not knowing what organizations are going to be impacted by this. So, and that's just me openly processing.
But this is Mary Lynn. I do like, I think it was Susan and maybe Jacqueline said, the big thing that we struggle even with the elderly is we get a lot of calls of people who are almost going to be homeless, and so it's that prevention of homelessness that I think is really important, and I think case management can really help with that, trying to help them with whatever, if it's utility assistance or counseling or getting whatever it might be. I think that prevention of homelessness, and we see this a lot. We've had over 20,000 additional calls this year, and there are a lot of people who are right there on the brink. And so I think that case management is really important.
So are we at a point where we can entertain a motion?
Before doing so, I would just like to express some of the discomfort that I'm feeling in hearing the more recent conversations. This is Karen with City of Chandler. I would be concerned about fully cutting some of the programs that we're talking about in regard to emergency services and housing support services, although I certainly understand the importance of putting additional dollars into prevention. I would feel very uncomfortable cutting those programs completely. Some of the additional funds that we're receiving at a municipality level have quite a number of restrictions, and so it does not cover all of the individuals that are in need. And I just want to make sure that there are some other funding sources available for those situations where CV funds are not being covered.
So would you be comfortable with 200,000 from line 5? Leaving 147,000 in line 5?
To me, that seems like a significant cut. I don't think that I would fully support the 200,000 reduction.
So where are you? Where would you be comfortable?
I don't have an answer for that at this point. I mean, these are all tough decisions. And clearly, the need is much greater than what the funding source is, regardless of the funding sources that we're talking about. I guess what I would say is I'd probably consider a more conservative approach. But again, I'm not sure how effective that's going to be either.
And this is Melanie with Gilbert. I'll weigh in also. I know the dollar amounts don't seem large in number 7, 8, 9, but again, I'd have a tough time, eliminating them until we know how they've been used and what they're doing, because they may be actually funding a person, and I don't know that, or what kind of services it's being used for, and what their other things. So I would have a hard time zeroing those out, although it could in the future make sense since it isn't a large dollar amount. So, but until we know, what that impact would be, that would be tough. I also find the 200,000 a pretty big chunk of change to take out of a line item. I know that even through the requests that we're seeing through our funding processes, the shelters are definitely requesting support. And again, we've been able to do some of that with our funds, but obviously I don't even think it's to the level that they need it. But again, I really am highly supportive of trying to get people before they get to the homeless piece of it. And so I know case management is critical for that, but I don't think I'm at the 200,000. I probably could do 100. And that's probably where I would be comfortable with line 5, moving to line 2.
Melanie, when they're contacting you for help, what are they asking for help with?
So when we take in, obviously our application process, really, we have a general fund, so, and then we just received also our CDBG CV. We had CV1 and then CV3. So we just opened our applications for both those funding sources. We obviously, when we do general fund, it's very flexible. We make it an opportunity for them to use it kind of any way they need to, knowing that we're hoping they're making the best decision of what that looks like. So a lot of times it's staff, it's supplies, it could be gas, so we're pretty flexible. When it comes to the CDBG CV3, obviously it's got to tie back to COVID. Those funding sources are pretty restrictive, but homeless is an automatic, at least it qualifies as a supportive service. So they can use it for staff. They just it's a lot of documentation when you do that. But I do find a lot of it is for, it's both operation and for staff support is what they're looking for.
Okay.
So since we are at 11:30, maybe time for us just to make a decision. So I'll make a motion, but what I would kind of state overall is that the entire time I've been on this committee, so almost 8 years, and there's people that have been on it much longer than I am. And so, but we have the same conversation year after year, and Brandy's done a great job. And before Brandy, Amy did a great job in trying to ask DES for more details on this, and we haven't received it. So my maybe it's we use that in the future and know we're just not going to receive it. So if we just feel comfortable doing what we've done in the past, to not not shake any boats there, then I think that's okay, of course. And I'm not trying to not have a conversation either, but I think we have to revise what our expectations of the information that we're going to receive on any of these categories. It's going to be limited. So I guess that's just my first statement, that maybe that's where we should have started, of just level setting of here's where we are. But if I'm going to make a motion, motion is to move for elderly, move the $25,000 that we noted earlier into home care, and then I would just motion to keep everything else the same.
Is there a second?
This is Jason. So Jacqueline, I will second that. And I also just want to acknowledge that this conversation and you leading this conversation and having a very hard conversation. I just commend you for it. And I respect the heck out of you for doing that, because I think that you're exactly right. I do think that for, and maybe, again, I'm having flashbacks of older, conversations like this, where requests have been made to say which agencies are these going to, and not getting a lot of detail. And I think it also begs a question for future conversations. Like, and again, I'm just going to pick on a number. It's not the group, and I know there's a lot of great work that goes with it, but like, how impactful is $37,000, right? And and that same question could also be asked of how impactful is $300,000 to $47,000, right? And so now, granted, if $347,000 was going to one agency, that's one conversation. If it's going to 37 agencies, that's a different conversation. And I know I'm being very facetious and kind of, in that kind of space. So I do think that in future years, if there is not that detail, which more likely than not will not come, it may be worth, this is just continuing on, maybe in these broad target groups, only having maybe 2 or 3 categories, and that's it. And it's just, and that's a conversation across the board that, really is trying to put a lot of funds very targeted. And I think that's your intention. And I really respect that, at least seeing that in the case management basic needs. But I think that that's something that we can look at, saying if we can't get that detail, then we should just really consolidate, just because, again, I see a lot of these smaller numbers, and I understand some of the paperwork that goes into sometimes accepting some of these dollars, and sometimes, and it could be a little bit of a pain. So I second your motion with a very long speech that I did not mean to give. So my apologies.
And if I can add to Jason, I think it's not only who gets it, but who are they serving and how many? Just to use elderly as an example, if you give me so many dollars for meals, I can tell you how many meals we serve, how many hours of bathing, how many hours of this. So, I think it's that same sort of thing, as we want to know who is getting the money and how many lives are they impacting.
And I think that's what most of us are used to, is because we do our own processes. And so this is really hard every time we do this every year, because we're used to being able to see the detail, because that's how we make our own decisions when we do our own funding processes, where we're allocating funds out. And this is really hard because it does seem so random. And I agree, when we look at these, 35,042, is that 5 different organizations that are getting it, and the amount of paperwork they might have to go through to get it? Does it, is it worth it? I don't know. And that's, again, I agree with Jason in that at some point, if there is a way to consolidate some of these categories maybe and target better, where that, the funding can be a lot more impactful in a sense, so I think that's why we all struggle with this every single time, is because we run our own things that we normally know where it gets used and what it does. So it seemed hard to be the recommending body when we just don't have that information.
Madam Chair, I realize there's a motion and a second on the table, and we'll need to take a roll call vote. Yep. Once we get to that point, I do have a suggestion and perhaps an opportunity for our next meeting to follow up with DES. So I'll let the roll call vote happen, and then I'll make that comment.
Okay. So Brande, are you able, or
to read the names?
To read the motion.
Oh, sure.
Make it fancy.
Yes, absolutely. And thank you. So Jacqueline making the motion to move $25,000 out of line item 17, which is elderly home delivered meals, to line item 20, which is elderly home care. So moving $25,000 from line item 17 to line item 20, and then for everything else to remain the same as we recommended last year. Is that correct, Jacqueline? Yes. Okay. So that was the motion, and then a second by Jason Matthews.
Okay. Is there any further discussion on this?
Madam Chair, do we need to have something by way of our formal recommendation requesting exactly what we want and need from DES? So do we need to enter a motion that says we are requesting details regarding agencies that are receiving these funds, what services are being provided, and numbers served? Or is that just a matter of Brande connecting with DES and letting them know that?
Historically, it's just been a matter of Brande connecting, but if we wanted to make a motion to formalize things, I think that we could, right, Brande?
Yes, Madam Chair, that is correct. I would do it as a separate motion. I would take the roll call vote for this motion, and then if the committee would like to entertain another motion around those requests, I would do that as a second item.
Does that answer your question, Susan? Okay.
Yes.
Okay. Then all in favor of Jacqueline's motion. Melanie?
Aye. Yes.
Nicky?
Aye. Yes.
Laura?
Yes.
Susan?
Yes.
Mary Lynn?
Yes.
Chris?
Yes.
Jason?
Yes.
Karen?
Yes.
Cindy? Oh, Cindy left. I think I got everyone.
Thank you, Madam Chair. I do have everyone noted for their motion. May I comment before you entertain a second motion, possibly?
Yes,
okay, just wanted to mention to the committee, so I was informed that our previous representative at DES that we'd been working very closely with has retired. So there is a new representative at DES that is handling the SSBG funding process. I have engaged with him. We've had some brief communication. He's just brand new to this role, but there could be some potential opportunity with bringing him in, engaging him with this committee, potentially debriefing on this conversation, and letting this person know about the challenges that we face as a committee making these recommendations with limited information. So we could go either way. We could take a formal action here to put into writing our requests, or we could proceed with an invitation. I mean, either way, we could proceed with an invitation and inviting the representative to the next meeting. So we could do that either formally with a motion or a more informal way. So
Right.
That is my comment. Thank you.
Well, I definitely would like to see us move forward with that. Is there anyone who wishes to make a formal motion for that?
Madam Chair, this is Jason. I'll make that formal motion. It's what Brande said. So but no, I think the formal written request to DES for, and again, others had mentioned this better, the agency information as well, who's receiving these dollars, as well as the programmatic metrics, including number of individuals served and what can else be served. And I also entertain friendly amendments if I'm not capturing that. But again, it was better said than I was, but I would support that motion of a written request.
Okay, awesome. Thank you. Is there a second?
I'll second that. That's really great news, Brande. It makes me hopeful that we don't have to just go on what we haven't received in all of these years. So really, that's great news. Thank you.
Very good news. All right, then I'll do the roll call vote. Melanie?
Aye.
Naomi?
Nicky.
Or
Nicky. No, and for Naomi.
Yes.
Yes, aye.
Linda,
Yes.
Susan,
Jason, yes. Oh, sorry.
Mary Lynn,
Yes.
Chris,
Yes.
Karen.
Yes, and once again, on behalf of Leah Powell.
Yes. Okay, I think I got everyone. Great, then that passes as well. For the sake of time, we're going to go ahead and skip the lightning round. We already have a request for future agenda items. Are there any additional requests for future agenda items?
Hey, Brande, maybe in the maybe at a future meeting or at the next meeting, you could share what's the new initiative that's going on around homelessness that you guys are leading. I think that for those, if there's anyone in HSTC that's not aware, if it's duplicative, then I like no need for you to do that. But for others who are not aware, I think it would be nice to hear from you.
I think that's a great suggestion. I would be happy to add that to the next agenda.
Thank you.
Also,
Madam Chair.
Yes.
I know that Leah was planning on sharing some information during the lightning round. She has been popping in and out of the meeting, so I'm not sure if she's available and if you would have time for her to provide everyone with an update.
So absolutely, when we get to comments from the committee, I figure that way we don't have to go around the room, but everybody can make a comment. Will that work?
That's fine. Thank you.
Okay. I did want to put something out there in terms of a future agenda item also. I recently started getting eviction data from Scott Davis from Maricopa County Justice Courts. He's very knowledgeable and passionate and has a deep understanding of the process. I don't know if you all are getting reports from him as well. Is there any interest in inviting him to speak to our group about?
Yes, Madam Chair, yes, that'd be great.
Cindy, do you have that contact or do I need to share it with you? I can't remember. Did I get it from you or did I get it from Jacqueline or?
If you can share that with me, that would be great, Christina, then I can follow up with scheduling.
Okay, great. I will do that. Okay, then moving on to item number 7, comments from the committee. Is Leah available?
I will check in with her and try to get her on the line.
Okay. In the meantime, does anybody else have any comments or anything that they want to share? Well, I want to thank everyone for your patience and having your heart in the right places that it certainly is. And it is a frustrating process each year, and it is encouraging to know there's hope on the horizon with new contacts who hopefully will also want to know where their money is going. So that's a positive sign.
Madam Chair, I was just informed that Leah's mic is not working.
Oh, no.
But she wanted to share with everyone that she is working on a plan to assist seniors with registering for the vaccine.
Oh, great. Great.
So,
well, we'd love to hear what that plan is when she has it.
Terrific. Thank you.
Thank you. Madam Chair, I'm happy to send that information to the committee. So if that's something that Leah would like to send over to me, I can distribute that to the group.
Great suggestion, Brande. Thank you.
Great. Thanks. All right, then I'll talk to you all in February, if not sooner. Thank you very much.
Thank you. Happy New Year.
Bye.
Brandy, this is
Yeah.
Laura. Can you stay on the line?
Yeah, Laura, so we're live streaming on YouTube.
Okay,
So
okay.
I think we should end the meeting and then I can follow up with you afterward.
Just give me a call. That's fine.
Okay, thank you.
Thanks.
Okay, the meeting is adjourned.
Trying to